Welcome to today's episode of the Nicole B Show, where the truth comes with no filter, no fear, and no allegiance to power. It's time to join me as we flip the script. Right. Today's conversation on the Nicole B Show isn't just timely, but it's absolutely urgent. The world we thought we knew changed radically in 2020, not because of a virus, but because of the unprecedented draconian response to it. I want to be clear from the outset. I was and remain vehemently opposed to the COVID-19 lockdowns. In fact, I question whether there was even a disease that warranted the extreme measures imposed upon billions of people. What we witnessed, in my view, was not a health emergency, but a global rehearsal in dystopian control, coordinated suppression, manipulation, and the systemic erosion of freedoms under the banner of safety. Tonight, I have the pleasure of speaking with someone who has done more than almost anyone to expose the mechanisms behind this shift. James Roguski is a researcher, author, activist, and natural health proponent. And I'm really glad to be speaking to him tonight. James?
Well, thank you very much for having me. And let me quickly expand on what you said. I agree with what you said. But the lesson that was learned by the people behind the WHO and all of these negotiations is exactly the opposite of the lessons that I learned, and I trust that you learned. They learned that big pharma was not big enough. They ran into problems producing enough of the tests and the drugs and the ventilators and things like remdesivir and all of the jabs, where they had trouble rolling it out fast enough to inflict those treatments on everybody in the world. And early in 2021, they realized that they weren't able to accomplish that goal of, I feel, injecting poison into 8 billion people. And they set out for these negotiations to expand their operations, to get government money to flow through an international organization, to do things that they talk about in terms of increasing the global distribution of the means of production, not for things that actually make people healthier, but for the tests and the drugs and the jabs and now the gene altering, I think, biological weapons. They are negotiating to expand what they did without ever, with one word, not one word, questioning the simple fact that what they did not increase people's health, did not save people's lives, but actually made things worse. They want to expand their response to the problem, where you have to ask, well, was the problem what they said the problem was, or did they create it through illusion and statistical manipulation? And is the solution actually the problem? And now they want to expand their ability to implement that type of solution all around the world. It's just absolute, pick one: greed, insanity, both, or just flat out evil. However you want to look at it, it's not for your health. It's to increase the transfer of wealth from everywhere around the world to the industry that preys upon people when they're not feeling well.
James, the experience of COVID and the lockdowns were quite different, around the world, but I found that your globalist leaders were probably the best at suppressing people. Now, if you speak to a South African, Cyril Ramaphosa was president at the time.
Mhm.
He's a total globalist. And South Africa had one of the harshest, most draconian, militant, and authoritarian lockdowns. Yet they had the least cases of COVID, and they had one of the sort of healthiest sort of outcomes. So that was proof positive that the COVID lockdowns and the response to the so-called virus had nothing to do with health. It had to do with seeing just how much you can control people and how much they would take. Is that sort of, was that the test? Was that the globalist test which leaders would comply?
Well, each nation, attempted to do those types of measures around the world. And so, in somewhere like the United States, we had 50 different states. So the
Mhm.
measures were different all around the world. But actually, South Africa is a big example. Going into a different topic, if you recall, Omicron was claimed by South Africa and Botswana to
Mm.
have been identified in those nations. And they did what they thought was what they were supposed to do, which was handed over the genetic information about supposedly Omicron. And this is where the start of these negotiations really is. They were not happy that that genetic information was turned into boosters by Moderna and Pfizer, and they didn't get to share in the benefits or the profits from that information. So, what's going on in the negotiations now? We can talk about the details of upcoming deadlines and so forth, is what they call a pathogen access and benefit sharing system. Nations have taken the position that the information about pathogens that they identify, believe what you want to believe about viruses and genetic sequencing and PCR tests and all that, put that aside. All of that are very valid questions. If they identify or create in a computer a genetic sequence that appears to be a potentially dangerous pathogen, they feel that that is a national sovereign resource. And if they're going to hand it over again, they want to receive some of the benefits. And so what we're dealing with has got nothing to do with health. It's got everything to do with, can you create or make believe or find, go out into the world looking into, jungle or desert or, the outback or wherever it may be, or into dairy operations or poultry operations or hospitals or the local bat cave or whatever it might be. Find some scary new version of Ebola or Marburg or the plague or pneumonia
Yellow
or bird
fever.
flu or whatever it may be,
Yeah.
and monetize that genetic information. Okay, think about the genetic sequence that was claimed, and I'm using my words carefully, claimed to be SARS-CoV-2. Well, that genetic information became $1 trillion business. So if you can find a genetic sequence that gets everyone in the world to respond by testing and taking drugs and jabs and lockdowns and everything, you've got a very profitable potential bit of information. If you're going to share that with the pharmaceutical companies around the world, you want a piece of the pie. And so the negotiations that the history of it, we can talk a little bit about, but they're currently ongoing. And August 10th is the deadline that the negotiating group, the intergovernmental working group, has told all of the nations and over 400 relevant stakeholders that please submit your proposed text for this negotiation by August 10th. Well, around the world, have any national governments asked their people, should we even be doing this?
No,
It,
South Africa voted in favor of it. I checked those who voted in favor and those who abstained. So South Africa's
Mhm,
had, in fact, voted in favor of it. And I can almost
mhm.
guarantee you that less than no one in the country actually knows what's coming their way when it comes to this
Mhm.
pandemic treaty.
So the voting that you're talking about was in many ways a psychological operation because what happened was the negotiations for the pandemic agreement actually failed miserably. They don't even have a rough draft of this pathogen access and benefit sharing system.
Right.
So rather than admit complete and total failure, they got nations to agree to some bureaucratic language on how they would set up ongoing conference of the party meetings and financing and so forth and so on. And they voted to adopt a pandemic agreement. But it says in the agreement that since we haven't finished negotiating the pathogen access and benefit sharing annex, no nation can sign the agreement. So it was trickery. It was a head game. Yes, they adopted an approximately 30-page document, but nobody can sign it because they didn't actually negotiate the hard part. And
Mm.
so many people have been led to believe, oh, the pandemic agreement has been adopted. I've read in many articles, people have said, oh, our national leaders signed off on it. No, no one, no one in the world has signed the pandemic agreement. It cannot be signed because the negotiations are continuing. They had a meeting in July, and what they agreed to in July was that all of the nations should submit their initial proposals for this pathogen access and benefit sharing system by August 10th. And they're going to be negotiating for the next year, if not more, in the hopes that by May of 2026, they may have a document that they can then have another vote on. And if that is adopted, then people could, or nations could sign on to this pandemic agreement. The benefit is that the core document that they did, quote unquote, adopt, they had been doing a very good job of keeping its final version secret. But now the pandemic agreement, the bulk of it that they agreed to, people can now read it. And they did a very good job of hiding the definition of relevant health products. They refer to the amendments to the international health regulations. And even if you go online, you're going to have a hard time finding the actual proper document. So I've tried to make it easy. People can go to rejectthetreaty.com or you can
Right.
go to rejecttheamendments.com and you can get access to all of the paperwork. And so the problem, as with every problem, it starts with awareness. 99.999% of everybody on the planet has not read the pandemic agreement.
Yeah.
They have no idea about what a pathogen access and benefit sharing system might be. And no one in their government, no one in the media is having these discussions in public. They're having these discussions in quiet. And the people who stand to profit from it, all the pharmaceutical companies and the civil society organizations, there literally is a list of over 400 relevant stakeholder organizations who are allowed to participate in these negotiations. But you or I are not allowed to participate. There's no
Yeah.
public comment. There's no, you know, put your opinion in as to what you want to do. Whenever people have been asked, they've said, we don't want any of this.
Mm.
But they don't care. They don't listen to people. They listen to those who have a stake, they're relevant stakeholders. Maybe they are donors or they may be written in as recipients. And so they want this business deal to go through because they stand to profit from it in the future.
So when you turn around and say, James, that this is about weaponizing a pathogen to make money out of, now, very
Oh, no,
interestingly,
hold on. That's not exactly what I said.
okay,
I'll clarify that just a little bit. They want to pretend
right,
to have found a pathogen with pandemic potential
okay,
and then share that through their biohub with laboratories around the world and pharmaceutical companies around the world to manufacture what they call countermeasures, right? Drugs and jabs and tests and whatever, to turn those into profitable products that they would have contracts to put into their strategic stockpile. Now, let me use an analogy. I'll use the military industrial complex, talk about the United States, right? For decades, since Eisenhower warned us, he said, be aware that the game that they play from the United States perspective, be afraid of Russia or China or North Korea or Iran or nuclear war or some enemy that's going to attack us. So with that fear, we have to be prepared. So we have to spend $1 trillion a year on aircraft carriers and fighter jets and missiles and ammunition and tanks and everything else for the military. And so we have $1 trillion a year that we spend to put all of these things into a strategic stockpile, hoping that we never use them. But if we go to war, and the United States is always at war, then you're using the things that were manufactured, and then they have to be resupplied. Well, if you use the analogy of, well, be afraid of Ebola or Marburg or the plague or bird flu or whatever else it might be, the WHO wants to put out contracts to the pharmaceutical hospital emergency industrial complex to manufacture tests and drugs and jabs and equipment and personal protective equipment, whatever it may be, put all the contracts out to put all of these things in warehouses in their strategic stockpile and be in charge of the logistics and distribution, while they are also in charge of being able to make a declaration. Oh, there's an outbreak in Borneo or there's an outbreak in Botswana. Be afraid, be very afraid. They can't make nations do anything, but they can coerce and manipulate and mess with people's minds where people say, oh, I'm afraid of something going on halfway around the planet. Let me run to the doctor and get the latest vaccine for whatever it may be. And
this
so,
is exactly what I wanted to say to you, is that when we look at, for example, Bill Gates, he has managed to monetize altruism, and he has become inordinately wealthy from so-called, I'm here to save you, I'm here to provide you with a health solution, I'm here to vaccinate Africa and use it as an experiment. And this is why I wanted to get to the point where you sent me this article where the HHS has now admitted on the mRNA platform that it is not safe and it is not effective. And this, I think, is the most important crux of this. And when I turned around and said, monetize it means vaccines. And when they have now stated that the mRNA doesn't work, and I want to also put it on the record that I got the Pfizer vaccine, and within an hour, I'd had a heart attack and I was being rushed to hospital. And so, for me, as far as I'm concerned, when I look at the adverse events that occurred from people taking the vaccine versus people getting COVID, they were 1,000 times worse. I mean, Veyers actually crashed at one stage from recording all the adverse reactions to the mRNA vaccines. My view, and I know this is an extremely controversial point of view, but it comes from a point of being, in sort of the medical sector, is that they are poison.
yeah.
Worse than any so-called flu or pathogen or virus that looks like a round little thing with all its lipids on. I mean, that was such a marketing tool. It doesn't look like that. No. So in that respect, that's what I wanted to get to, is that these remedies or treatments are actually not even safe. So what is the end goal when they know that mRNA doesn't work? That finally the CEO had to admit that it doesn't stop transmission. So where are we? Where is this going then?
Well, it always starts with awareness. And so, wherever you may live, if you could just imagine, walking out into the community, knocking on people's doors and asking people, what is it that you believe? You'll get a whole spectrum of what people have come to believe because the propaganda is unbelievably powerful. Even though RFK Jr. just said yesterday that the mRNA injections were not effective, were not safe, he didn't say we're taking them off the market. They're still available. They're still being promoted on government websites and out in the world as being safe and effective. Get your booster, get your booster, get your booster. So, the dichotomy of, wait a minute, the evidence, the experience, the facts say one thing. Here in the United States, we have a law referred to as the PrEP Act, which makes it so that it's astonishing. And even when I say it, people don't hear it because it's just too crazy. The Secretary of Health and Human Services can say, just because he wants to, not because something is approved, not because something is emergency use authorized, just because he says, we have an issue and I believe that these products are what needs to be used, he can refer to those as covered countermeasures. And if any person in the medical establishment, from manufacturer down to, the technician that is injecting people with it and everybody in between, are called covered persons, if any harm comes to the person who, not just injections, but things like remdesivir and drugs and, PCR swabs, whatever it may be, if anyone is harmed, the PrEP Act states that you cannot sue them because they are covered. And so, in a sense, the government has taken away our Bill of Rights, Amendment number 7, guaranteed right to have a trial by jury if we want to bring suit against someone who's harmed us. They've unconstitutionally taken that away, and they've put the government in a position kind of like an insurance company who says, well, I'm providing coverage so that if you want to sue, you can't sue the hospital establishment, you can't sue the government. They have a compensation program, but they deny all the claims, like
Yeah.
insurance companies will often do. You have a problem and, maybe you have a car accident and you paid 50,000, dollars for your car, and they offer you $4,000 because your car is a couple of years old. Wait a minute, that's not what you thought insurance was supposed to be. In all of this time, the last report, only 39 claims have been paid out by the government's compensation program for these countermeasures. And so essentially, it has taken the risk and socialized it and prevented it. There is no risk to the entire industry to inject or administer poison because the law makes it so that you can't sue them. And the government's promise of insuring you and having a, a compensation program has been applied in a way that they deny all the claims. And so what we're what I'm trying to do here in the United States is to get that law repealed. But it's similar in other countries in that contracts maybe have been signed or laws have been put in place. And when people are harmed, they just deny it. They go, oh
Yeah.
no, it wasn't because of that. And people are being harmed. It literally amounts, the term is democide. It's when your government is trying to kill you.
Yeah.
And people don't want to believe that. It sounds crazy, but all you have to do is listen to the video that RFK Jr. put out yesterday, which was August 5th. He said, we know that the drugs or the mRNA injections do not work. We know that the risks outweigh the benefits. If he had then said, therefore, we are taking them off the market, you would go, okay, great. I applaud your action. Finally, it took a
Yeah.
long time. That's not what he said. And here's what people missed. It says in the documents that companies like Arcturus and Amplitude, the funding will continue. Well, what are those companies developing? They're developing self amplifying mRNA and trans amplifying mRNA, which is probably a term that nobody's heard of. So essentially, what they're saying is we know the mRNA didn't work, but now we're hoping that supercharging it with self
Yeah.
amplifying
We'll
and
try
trans
something else.
amplifying, we'll try something else. And you got to
Yeah.
scratch your head and go, wait a minute. They're admitting in writing and in video that they know that the products that they've been promoting for the last 5 years did not work and caused more harm than benefit, and they're not taking them off the market. Well, what does that mean to the average person? To me, it means they're trying to harm you.
Yeah. Well, in the United Kingdom, they started reclassifying people who were experiencing really serious adverse effects from the vaccine. They started reclassifying it as long COVID. But
Mhm.
these were many people who didn't actually even contract COVID or who had never ever tested positive for COVID, but who had had vaccines. So we're getting to the
Mhm.
stage where, and we're talking about people who have lost their ability to even walk, and they've had
Mhm.
heart attacks and multiple, myocarditis, and all the rest of it is developed. Now it's reclassified as long COVID. No longer are you allowed to report or even admit to the fact that what you're suffering from is the ill effects of the actual vaccine.
Mhm.
And so this is a conspiracy. This is a government conspiracy, who are conspiring against the health and the welfare of their population.
Let me agree with you, but let me add a word to the discussion, okay? They are clearly and blatantly colluding. They are
Yeah.
working together hand in glove, government and industry, to lie to the public, to hide the data and the truth, and to manipulate people's minds when people undergo some type of treatment, whether it's something like remdesivir or the jabs or whatever. And it's very clear, as in your case, unfortunately, I'm glad you're still here to tell your story. It's obvious that the treatment caused the problem. They work together to just hide that information and deny it and not do what you think regulatory agencies are supposed to do, which is protect the public from products that cause harm. In the medical establishment for a couple of decades now, I have clearly understood that the tests and the drugs and the injections are not things that help people become healthier. They're actually customer acquisition tools. And if you look at how COVID shook out, healthy people who were told, well, in order to go to work or to travel or to go to some event or whatever, you have to get tested
Mm.
with a process that is not a diagnostic test. The
Yeah.
PCR process does not diagnose disease. It is an illusion. It is a fraud. You can go to pcrfraud.com and see what I've written about the facts behind that.
Yeah.
To take a healthy person and prevent them from engaging in their normal life, can't go to work, can't go to school, can't travel, can't go to an event, can't, go out into public.
In South Africa, you
To,
weren't allowed to buy toys and you weren't allowed to buy grilled chicken. Somehow, buying grilled chicken would give you COVID. I mean, it was
okay.
insane.
And so the tests are fraudulent. They're not actual tests. They don't indicate whether or not someone is potentially a danger to their fellow human beings, but it was accepted by the government. And so if a person who was completely healthy took this fraudulent test that said, oh, they've been exposed to SARS-CoV-2, they were called, asymptomatic COVID patients, cases. Okay. Oh, you have to go into lockdown or whatever. Then if they were in a hospital and they had any kind of an issue, they were given a whole nother level of poisons. In the UK, ventilators and things like midazolam to stop their ability to breathe so that they could be forced to have a mechanism, a mechanical ventilator, breathe for them. The exact most insanely wrong thing to do to somebody who's having respiratory difficulty, probably killed more people than any ailment may have. Add to that remdesivir, which damages the kidneys to cause fluid to build up in the lungs. If you've ever seen the tube that's used with the ventilator being removed from a person and the just enormous amount of mucus that was congested in the lungs because of the treatment,
Mm.
people were murdered by the treatment. We're not even talking about the injections and how if if you understand what the mRNA platform actually is purported to be, and you realize that when you have an injection of those substances go into the bloodstream in the body, they do not stay in the arm. That's not even debatable anymore. They are known to spread throughout the body. They're designed, according to the people who promoted them, to trigger an immune response. But the genetic sequence that is used has never appeared in nature. That's not speculation, that's with clarity. They altered the genetic sequences by adding pseudouridines into the sequence to make it more stable. And so it's clearly a synthesized biological weapon to trick your immune system to respond to something that you could never possibly be exposed to, which makes your immune system do exactly the wrong thing. But it's even worse than that because the type of antibodies that your body makes when it is dealing with something that is in your blood are not the type of antibodies that your mucous membranes in your respiratory system would make to protect you from a respiratory pathogen. So Dr. Sukrit Bhakti talked about this 5 years ago. It's impossible to have an injection of a substance to protect you from a respiratory ailment because the body's response is not the same as the body's response when you breathe something in and your mucous membranes and your immune system respond to whatever you've inhaled. By definition, it could not ever possibly prevent a respiratory ailment.
Mm.
Now, still, they promote it. As you mentioned, Pfizer and I don't know if it was the CEO, but certainly executives said, oh, we never even tested to
Yeah.
see if it would stop transmission.
Listen.
Okay. So, on one hand, you've got people saying, well, you have to get injected so that you don't catch the disease and you don't give it to grandma or vice versa. Grandma doesn't give it to the children. It's not possible. I mean, it's literally anatomically not possible to have such an injection prevent the ailment. Therefore, it cannot prevent transmission. They never claimed that it prevented either of those things, but
Mm.
yet it was promoted as safe and effective. And you've got to get the shot so that you don't get somebody else sick, even when you're not sick to begin with. And so lies upon lies upon lies upon lies upon lies. But yet people to this day are walking around wearing masks, volunteering to go get their
Bizarre.
10th booster,
Yeah.
and are ready, willing, and able to volunteer for whatever new type of product, whether it's self-amplifying or trans-amplifying, might find its way onto the market. And the negotiations that are going on with the WHO want to go looking for more pathogens and enable them to declare things that are emergencies, not because people are dying, not because, it's spreading around the world, just because the Director General has the authority in the international health regulations to say there's a pandemic emergency.
Yeah.
Now, they cannot make people do anything, but they use these authoritative sounding declarations to, one government will say, well, the WHO said so, so we're going to, say that you need to do this. And the coercion and the pressure and, quite frankly, blackmail that they use, oh, you're going to lose your job, you can't travel. It's hard for people to say no, but you have to realize that they don't really have authority over your body. They make it seem like they do, and they have tricked billions of people into volunteering to allow this to happen to them, and they will do it again and again and again and again
Well, I mean,
until enough
eventually,
people wise up and
yeah.
say no. Yeah.
In the UK and South Africa, people lost their jobs if they weren't willing to get vaccinated. I mean, to what point do you get to a stage where you're threatening people with the loss of their income? I mean, people lost their businesses and everything like that for
Mhm.
the sake of a disease that didn't exist, and for the sake of people that actually gave in to what I consider to be one of the most effective propaganda campaigns I
Mhm.
have ever seen in my life. In fact, Nazism and communism would have been jealous to see to what extent people just gave up their freedom and gave up their rights and got injected with poison
Mhm.
just for the sake of being told you have to do it or else you're going to kill somebody. If you don't have the vaccine, you're going to kill somebody. And I think this is, do you think though that people learnt from COVID? Do you think that when this treaty is is finalized, are people going to agree to it? Did we learn, or are we going to make the same mistakes again?
Well, I'm not going to use words that manifest success for their negotiations. Okay.
No.
They have failed so far to reach agreement on this pathogen access and benefit sharing system. We have an opportunity to educate as many people as possible to comprehend all of the things we've just been talking about. And so, what they are trying to accomplish is to grow the industry that they felt had deficiencies. They were not able to manufacture 8 billion jabs all at once, but they're busy building factories around the world to manufacture products that don't work and cause harm. Now, when you speak to any individual person and you ask them, would you ever allow yourself to be injected with another mRNA jab? Do you know what self-amplifying mRNA is? Do you know what trans-amplifying mRNA is? And if you had a respiratory ailment or some other ailment, what would you do to regain your health to help, with breathing or whatever other the symptoms might be? The battle ultimately is in the mind of each individual person. if you know enough about your body, if you know enough about natural health to know that those solutions are just smoke and mirrors, they are poisons that damage your immune system, it's a very simple answer. No way in the world could you ever convince me to do any of those things. But a lot of people do not have that knowledge. They are not aware of the options that are available to them to maintain their health. They believe their doctor, they believe somebody in a white lab coat or somebody on television or some government official who says you have to do this. No,
Or
I
Professor
don't
so and
have to.
so who comes and says,
Or
we
this,
rolled out the professors in the UK. Trust me,
this
every
study
time
that
we go
was
to a meeting. Yep.
this study that was paid for by Pfizer promoting Pfizer's products or whatever it may be. And so, on one level, it's an individual issue where as more and more and more people have this eureka moment and they become aware, wait a minute, they lied to us. They
Mm,
blatantly lied. They blatantly harmed, and quite frankly, murdered people in the hospital. And they're continuing to try to do that.
mm,
But there's also this world of, well, ultimately they made it in many cases so that people were coerced and then they gave in and they volunteered. And
mm.
so they preyed upon the weakness. Oh, I have to keep my job. Oh, I want to travel. Oh, my kid needs to go to school. All these sort of things. The psychological operation behind it preyed upon people's fear and
Mm,
people's weaknesses and lack of awareness of, what their legal obligations and legal rights were. And so many people gave in to the pressure because the pressure was enormous. And so what we need to do is inform people, look, there's always another option. Injecting yourself with poison is not a pathway to health, despite what they want to tell you.
yeah.
And we have to realize that in each local jurisdiction, there are laws in place where if the local official says, oh, there's an emergency, the laws make unethical, immoral, illogical, harmful actions legal. And when you look at what the emergency preparedness laws allow government officials to do, you realize that they have pre-positioned and pre-corrupted the law to give them authority that they should not have. And those laws need to be repealed or revoked or removed, whatever terminology you want to use.
Mm,
And it's not that the WHO is saying you have to do this. Okay. In some countries, Malta, I just did an interview with people in Malta. The Maltese government years ago passed a law that said whatever the WHO recommends is automatically a regulation in Malta. Oh my God. I mean, that is an abdication of your sovereign control over
yep.
your own public policy. Now, laws like that may exist in other countries, but quite frankly, the laws in most countries are even worse than anything the WHO would have ever imagined.
Yeah.
I can think of laws in South Carolina and in California and in Western Australia and British Columbia that give government officials enormous authority to do horrific things. And they go, well, the WHO recommended this, so we're going to declare an emergency locally. And that triggers emergency powers, which are horrific. But that's an issue that people have to deal with locally. And so unfortunately, the battle continues. You have to understand that just because your local official declares that there's an emergency, I mean, think about it. Somebody on some far-flung continent halfway around the world reports some illness. The director general declares a pandemic emergency and your local health officials declares an emergency. You're thousands of miles away, but they've just given themselves powers to
Yeah.
control your life that are written into laws that were enacted when you weren't paying attention.
Mm.
And in the United States, those same laws, like the PrEP Act, say, well, if what they do harms you, too bad, you can't sue them because the law says they're protected, they're covered. And so, we have a lot of work to do all around the world. The battle is slightly different in every area of the world, but it starts in the awareness of each individual person that these people are not operating with your health in mind. They're setting up a system that is designed to actually harm you
Yeah.
because that's good for their business, whether it's the test or the drugs or the injections, and now gene altering therapy. Um, Ultimately, it degrades people's immune system, gives them vaccine acquired immune deficiency syndrome,
Yeah.
VAIDS, and now the person is got every problem imaginable, and they just deny that it was caused by the
Mm.
product that they convinced the person to take. And unfortunately, many people, continue to fall for that story.
Do you think that a big part of this is the fact that big pharma funds government? They fund every lobby organization. I mean, we don't have lobby in England and in the UK and in South Africa and that, but they do. But big pharma funds government.
In the United
And
States, the last time I checked, approximately half of the budget of the FDA, which is supposed to be the regulatory body for Big Pharma, is funded from fees that Big Pharma pays to get their drugs, quickly
yeah.
approved. Um, you'd be very hard pressed to find any representative or senator or candidate for any kind of office, such as president, who have not received all kinds of donations from pharmaceutical companies. And the lobbyists that circle around Washington that are paid for by big pharma and get access to, the staff of congressional offices to promote legislation. They write the legislation, they donate to the Congress people, and they go, here, sponsor this, and it gives them liability protection. All of this was done 20 years ago and is ongoing. So the answer to your question, the short answer is in the United States, absolutely. In other nations, there are varying degrees, and a lot of those protections end up in the contracts. And so when you've got government officials, negotiating contracts via text message, to funnel money into industry that, in the United States, it was known as pork barrel politics. The idea was every representative has to bring investment back from the federal government to their local district so they can talk about all of the money that they're bringing into their district. So what's going on now with the WHO is they want investment to flow through the WHO to go to Africa or, island nations in the Pacific or the Caribbean to build manufacturing capacity, get, a small amount of high paying, high tech jobs for cronies who are oligarchs in those industries in those countries to tout, how they're improving the local economy by developing the industry that is actually degrading people's health under the guise of public health and equity.
Mm.
And so it's very easy to be taken in by the illusion that they're trying to make you healthier. They're trying to make themselves wealthier. And the manner in which they do that is they convince people to do things that degrade their immune system under the guise of protecting them from some unseen pathogen. And then the adverse events and the side effects and the long-term imbalancing of a person's immune function is ultimately really good for business. now the person becomes a lifetime patient because the treatments cause more problems than the problem that they were designed to treat.
Absolutely. I think in South Africa, America exports its influence. So they'll send the likes of the Bill and Melinda Gates Foundation, which will trot across to South Africa and will draft a comprehensive plan for our NHI, which is our new national health insurance that they want to implement in a country where only 5% of the population actually pay tax. So there's no, so I think that this is what happens in South Africa, is that America exports the likes of Bill Gates, who comes with his monetized philanthropy and arrives on South Africa's shores and then sells them vaccines. And make no mistake that the ANC is that corrupt that
Mhm.
they are just open to being paid by whomever for whatever it is that they're going to get out of it. The United Kingdom, I think it's subtle influence. It's what they call soft influence, but the influence is still there. I mean, I think there was a controversy linked to Matt Hancock at the time, who was a health secretary during the COVID era, that there was a very high rate of midazolam that was ordered during the pandemic,
Mhm.
much higher than at any other time. So they're giving this midazolam to. And so many elderly people just conveniently passed away during COVID.
Mhm.
One problem solved. Our elderly,
Mhm.
it's a huge burden on the system and that sort of thing. So what better way of an excuse to sort of like, ease the path to that? You weren't allowed to go and see your parents. You weren't allowed to go and see elderly people because they didn't want you to know. They were hiding what they were doing. And I think this is the problem as well, is that this sort of pandemic, this sort of response to a so-called disease provides them with cover for an altogether nefarious activity that they're involved in. And I don't, I worked deeply in the health sector. I was at one stage, I worked for Big Pharma. I know how they work, I
Mhm.
really do. And at the time, I suppose I didn't really see it. I didn't see what was coming out of it. Look, I must admit, I worked for companies that did some really good products, I think, and stuff like that. But I also did a fleeting job for a company that produced vaccines. And I'm like thinking to myself, I actually got told once there's really no clinical studies that prove that the flu vaccines work, yet
Mhm.
they roll them out every year. And I'm thinking,
Mhm.
but they don't work. Why are you giving them to people? It's money.
Exactly. Exactly.
Right. So as we end off, James, I think what I'd like to know from you is, what should we be doing? Like you say, myself as well, I don't want to get to the stage. I don't want to reach 2026 and find that the WHO has signed PABS and has signed this treaty. How do we get to the point where we stop it?
Well, the answer to these questions is kind of always the same, right? Number one is awareness. And the vast majority of people are kept in the dark. They don't know that these things are going on. If you went on the street and asked people, what do you think about the amendments to the international health regulation, or what do you think about the pandemic agreement, or what do you think about the pathogen access and benefit sharing system negotiations? If you ask them, in the United States, what do you think about the PrEP Act? The vast majority of people would say, I have no idea what you're talking about. And so step number one is awareness. And it, it, it really requires that people take a moment to actually, watch some videos, read some documents, and get a clear explanation of, this is what they're doing off in the distance in these negotiations. They're setting these things into law or international law or contracts, and they're defining, relevant health products for a pandemic. Well, wait a minute. What about herbs and vitamins and minerals and nutrients and homeopathic remedies and other natural, indigenous treatments for these things? No, they're kicking all of that to the curb. So if you can generate curiosity, where if you ask people a question, where the honest answer is they have no idea. Some people just won't care. They just don't care. They don't have the time. They're busy. They're trying to survive. They're not going to, really do anything about it. But some people will be curious. They'll go, I have no idea what you're talking about. Can you share some information with me? So I've put all the information on rejecttheamendments.com
Okay.
for the amendments to the IHR. You can go to rejectthetreaty.com for information about the pandemic agreement. And in the United States, and really, quite frankly, around the world, because it's similar, you can go to repealtheprepact.com to get an understanding of, what is it that they're doing. But the bigger issue is to reach out to your health minister, your government officials, your members of parliament, and go, I know that this is going on. How come you're not bringing this to the public to have this discussion? Why did the amendments get adopted and nobody asked for my opinion? Why are these negotiations for the pandemic agreement halfway along and they're negotiating something about pathogen access and benefit sharing system? And I can almost guarantee you that your members of parliament will not have a clue. They have no idea because in many cases, they're as, ill-informed as anybody. The health ministers who are in charge of these negotiations are listening to industry officials who want this to happen because it's good for their business.
Yeah.
And
Well, I
nobody
can
is
guarantee you in
questioning.
South Africa, our Minister of Health is clueless. So, you can take it as a given.
And so what we're dealing with here, I've called it the new OPEC. It's
Yeah,
not the oil producing and exporting countries. It's the Organization of Pandemic Emergency Corporations.
right.
These negotiations have been co-opted by business interests who don't care about you and me. We're just, people off in the distance. If they can get the contracts, if they can get the deal done, their business will prosper. It's got nothing to do with health. It's got nothing to do with public health, that's for sure. And if they can get these agreements in place, the money will flow to their industry, which doesn't make people healthier. It actually degrades their health.
Mm.
And they don't care. It's obvious that they don't care with what they've done over the last 5.5 years. And RFK Jr. laid it out very clearly. They know that the jabs didn't work. They know that the harms outweighed the benefits, but the products are still on the market and they're putting money into researching self-amplifying mRNA and trans-amplifying mRNA, which are different, but by all stretch of the imagination, even worse.
Yeah,
And because they're not tested and they're experimental, they're shifting the focus and everybody is saying, oh, great, wonderful. No, this is horrific. And so there's quite the battle ahead. It starts with being informed. It starts with identifying like-minded people who are allies in this cause. And, then reaching out and just saying, no, this is crazy. Um, Look for natural alternatives to maintain your health and stay as far away from this poison as you possibly can.
yeah. I said during COVID that we are a mass-free clinical trial.
Good.
And I put it off as long as possible until I got threatened, and that was it. James, thank you so much for your time. I'm hoping that we can have another conversation. From my side, I'm determined to bring about a lot of awareness and attention about the so-called pandemic treaty and PABS and that sort of thing. So I'm hoping we can have another conversation. I'm going to start writing some articles and let's try and see if we can bring about that awareness and push our governments to actually reject any sort of loss of sovereignty over our health and what we can and can't do with our own bodies. I think that that is the most important thing, that at the end of the day, you get to decide what you put in your body and what you don't. And that is it. And no government should be allowed to force you to do something you don't want to do.
No government, no industry, no business, no
Yeah,
employer, nobody. Yeah. One last
nobody.
thing, if I may, I
Yeah,
always give my phone number. I live in California, so I realize your audience may be international. My phone number is 310-619-3055. If people use Signal or Telegram or WhatsApp, or text message, call me, text me, use any of those communications apps. I'm pretty sure that's how you and I got connected, I think,
yeah.
through WhatsApp.
WhatsApp.
Yep.
Yep.
If anybody has any questions, I'll do everything I can to, help get you answers to what your questions may be. 310-619-3055. If you put that in your contact information and you look for James Roguski on any of the apps, you should be able to reach out to me, and I look forward to helping anybody I can.
Well, James, I will put it at the end of the video. I'll actually put it on at the end so that people can actually write it down, and it'll be on when we load it onto social media as well. I'm happy to do that. I'm going to tag some of your articles so that people can start actually reading. They can subscribe to Substack and that sort of thing, and they can start reading what you're writing about, because I think it's absolutely vital. James,
Well,
thank you
thank you very
so much
much.
for your time, and thank you for everything you're doing.
Thank
To
you
my
for having me. I
listeners,
appreciate it.
thank you for joining me. If you found this discussion thought-provoking, help us keep the conversation going. Hit that follow button on Spotify, and don't forget to connect with me on X, formerly Twitter, and Facebook. Until next time, stay curious.